Thomas Byrne. Mr. Byrne.
Gur mágad a chahirig as an deis thuirtam an táhair táhacht seo ordú bhí sé an skedul an deirtin se catach ní ra mé an seo an am chun é ordú an lá sin bhí mé ceire nóméid déanaach an lá sin. I rise this morning to raise an important issue that is causing considerable concern, Minister, in the area of Duleek in County Meath, and in particular in a very small part of that village, it has to be said, and indeed according to the media reports in relation to Mornington as well, which is about 7 miles away. There have been a number of cases of a disease called Guillain Barré Syndrome, which I suppose I'll call GBS for short. The best description I'll give of GBS is from a victim of that condition who wrote a little booklet about his experiences before he knew there were other people in his area. And what he says is, the immune system of the body attacks the nerves going to and controlling the muscles. Instead of the signal from the brain telling the muscle to move, it goes to the outer skin where it feels like pins and needles or severe nettle stings, all the while happening. The illness starts at the toes and feet, moves up the lower legs, and sometimes reaches the neck area. Even the face and eyelids can be affected. All bodily functions are knocked out as it comes up the body. Bowel, bladder and lungs can also be affected. So clearly this is a very, very serious disease. Fortunately, it's a very, very rare disease. I understand that one would expect 1 or 2 cases per 100,000 of a population, and that's not per annum, that's in total, as I understand it. But as I understand it in County Meath, there are 4 confirmed cases in the village of Duleek. I've met 2 of those people with confirmed cases of Guillain Barré Syndrome, GBS, who are recovering. They're neighbours. And I understand that the other 2 confirmed cases live very close to them. There are 2 other cases that GBS may be implicated, as I understand it, and they again live very close to the people who have been confirmed as suffering. The case that the media reports in Mornington I'm not familiar with, but that's 7 miles away. I think if you read the literature on Guillain Barré Syndrome, it is very rare, but there is also literature to suggest that it does cluster. And in many of the clusters that have happened, and we see references in literature to China and to Arizona, environmental causes sometimes are linked, whether it's water, whether it's there are other issues as well. There is a medical trigger for Guillain Barré for GBS, and that is usually an infection. But I suppose we want to know why is there so many cases in this very small area. I should say as well is that the clusters that have become apparent in other areas are over many years with only slightly more cases than have been seen in this very small village. So this cluster, apparent cluster in Duleek, County Meath and in the general East Meath area appears to be quite significant. These people have been affected in the last year or 2 years, as I understand it, and have been affected very, very badly. Now, this is an area with environmental concerns, it has to be said. I'm not going to go into them today because it's not my role to blame anyone if blame can be apportioned. But certainly talking to those people who are suffering and continue to suffer from this, in one case 2 years on from the first acquisition of the disease, they are very, very keen to see if there is a reason for the number of cases in the area, and they're keen that nobody else would suffer, and they're very, very keen to find that out because they themselves have suffered hugely. It's deeply worrying for all of us. I live myself within about 3 miles from the 2 victims that have been confirmed and that have met me. So it's deeply worrying for people in the area. We would like to see a HSE investigation. I understand that has been agreed to, but I think that should include the EPA. It should include Irish Water as well, because in some cases water has been. Now, I'm not saying that any one cause is a cause of, or anything to do with GBS. What I'm saying is that we should investigate all possible causes and do as much as possible. I understand there is another case as well in the general Cavan Meath vicinity as well that has been mentioned to me too. I won't say exactly where because I don't have first-hand information. But this is of concern. Some of the clusters that have been reported in the literature over the years would encompass large areas, maybe the same size as County Meath. This is a very, very small area, and if there are other cases in County Meath, it even paints a more worrying picture. We're looking for answers, Minister. We're looking for this investigation to proceed as quickly as possible in a short period of time, and to bring in all the statutory agencies that may be relevant to it, and to try to get answers for these people. I would say, though, that those people who have been in our acute hospital services as a result of this have nothing but praise for the staff. And I think it's very, very important to mention this because there's a very, very rare disorder, but the staff in Our Lady of Lourdes Hospital in Drogheda have received very high compliments from the 2 men that I met who are victims of this. And I'd like to put that in the record because they often get forgotten this. But the big issue here actually is to see, is there a reason for this, and if there is a reason, to put an end to that reason.
And Tara?
Excuse me, I'd like to thank the Senator for raising this issue. As rare as it is very, it's very traumatic and upsetting for the people that acquire it. Guillain Barré Syndrome is an autoimmune disorder in which the body's immune system attacks part of the peripheral nervous system. It usually occurs a few days or weeks after a person has had symptoms of a respiratory or a gastrointestinal viral infection. The symptom is slightly more common in men than women and can affect people of any age, including children. The syndrome is rare, affecting only about one person in 100,000. It is estimated that 50 to 100 people are affected in Ireland annually. However, as Guillain Barré syndrome is not a notifiable disease, there is no requirement on doctors to report cases. Guillain Barré is called a syndrome rather than a disease because it is not clear that it's specific, as the Senator has already pointed out. It could be a lot of reasons. A specific disease-causing agent is involved. Syndrome is a medical condition characterised by a collection of symptoms, what the patient feels, and signs, what a doctor can observe or measure. The signs and symptoms of the syndrome can be quite varied, so doctors may, on rare occasions, find it difficult to diagnose it. 2/3 of people with Guillain Barré syndrome are known to have experienced an infection before the onset of the condition. Most commonly, these are episodes of gastroenteritis or a respiratory tract infection. Approximately 30% of cases are provoked by, and I'm only going to say this once, Senator, as you can, you have it there in front of you, a Campylobacter jejuni. And are provoked by Campylobacter jejuni, with further 10% of cases attributed to cytomegalovirus. Despite this, only very few people with Campylobacter or cytomegalovirus infections develop the syndrome. Links to other infections are less certain. Most people make a full recovery within a few weeks or months and do not have any further problems. However, some people may take longer to recover, and there is a possibility of permanent nerve damage. There are therapies that lessen the severity of the illness and accelerate the recovery in most patients. I have been informed that officials from the HSE met with members of the local environmental group from the East Meath area on the 28th of January in Navan. These groups voiced concerns that a number of the cases were related to environmental issues in the Duleek area. However, it was clarified that the majority of confirmed cases of Guillain Barré syndrome are linked to a previous episode of infection or vaccination or a surgical intervention rather than to environmental factors. The Department of Public Health and North East has agreed to follow up on these cases to try and identify possible causes for this apparent cluster of cases. This will include meetings with the individual patients in the near future to progress that investigation. And I would hope, Senator, that when those meetings take place, that the concerns around whether or not it's waterborne or whether or not there are other environmental issues will come up, and if there is need for further investigation, that will be taken on board.
I might also take the opportunity to encourage anybody who may be a victim of this, who hasn't come forward, to go directly to the HSE. They don't have to come to me or a politician or any local group. They can go directly to the HSE and ask that they be interviewed in relation to this. The Minister has mentioned gastroenteritis, and which I think is Campylobacter jejuni, and respiratory tract infection. I suppose that is where some of the environmental concerns come from, but at this stage nobody knows what is causing it. But I think it's important that nothing is ruled out, as I understand it, and just to be of help to the Minister, and from some of the literature I've read around this, and all of us are beginning to find out information about this. None of us is an expert in this area, or none of us really had any knowledge about this until this came to light a few weeks ago. That the vaccination issue was back in the 70s, that it may not be relevant today, but I mean, I suppose there's a lot of research has yet to be done, but certainly we want to see what, if anything, can be done about this. We're not putting pressure on the HSE as such. We're asked that they have already agreed to carry out an investigation. That's very important, but I think we would like to see that done as quickly as possible, but as comprehensively as possible as well. Thank you, Minister.
Clara?
It just strikes me, Senator, and you're right. I mean, we're going to more and more come across, and especially with the advent of Facebook and things like that, that people can communicate better with one another. I mean, I'm assuming that people who would have developed this syndrome in the past would have been felt quite isolated and not known that there were other people with the same difficulty.
Neighbours didn't know that they suffered from
Exactly.
it. So,
Yeah, you know, it's not knowing that other people. I think Facebook and that sort of interaction, most definitely is a help in this case. But on the other hand, I would very much like yourself not rule anything in or out because we are learning all of the time. But it does equally make the case for ensuring that our water system is clean and safe. Thank you.
Thank you, Minister. Fourth motion.